Welcome to the Oregon Health Authority's Non-Discrimination Policy for the Public, Introduction to Individual Rights. Our learning objectives today are to understand the connection between civil rights for the public and OHA's core values, your responsibilities in reporting and preventing discrimination as OHA employees, how to identify a report of discrimination, and the procedures for documenting and responding to reports of discrimination, and also to just know where to go for additional help if you need so. We will now review two case scenarios which illustrate the importance of a non-discrimination policy for the public. In case scenario number 1, a 63-year-old homeless Spanish-speaking person was admitted to a psychiatric medical center. The individual's language issue limited medical staff from performing various psychological assessments. The Health and Human Services Office of Civil Rights found that the individual did not receive consistent interpretation services during his 150-day stay at the center. In another case, there were 3 complaints filed with the Office of Civil Rights in 2012 from patients with limited English proficiency who speak Triquibajo, an indigenous Mexican language. All of the complainants had indicated that they sought health care at their local hospital, but had difficulty communicating and understanding healthcare staff because of insufficient language access services. In both of these case scenarios, the Office of Civil Rights reached a voluntary resolution agreement. Some of the conditions within that voluntary resolution agreement included a requirement for the hospital to revise and implement its language access policies and procedures to ensure oral interpretation and written translation services for those with limited English proficiency, a designation of a coordinator who could ensure language assistance for individuals with limited English proficiency, the appointment of a community advisory board that included members of the local community to address community needs and access to qualified interpreters, to provide notice of the right to free language assistance to persons with limited English proficiency in a language they could understand, and for the hospitals to conduct employee training with regard to providing services to limited English proficient patients. OHA's non-discrimination policy clearly states that OHA operates its programs without regard to race, color, national origin, religion, sex, sexual orientation, gender identity, marital status, age, or disability in accordance with applicable laws, including Title VI of the Civil Rights Act of 1964, the Americans with Disabilities Act, Section 504 of the Rehabilitation Act, and Oregon Revised Statutes, Chapter 659A. OHA's non-discrimination policy directly aligns with our core values as an agency and requires us to use those core values in understanding and upholding the provisions within our non-discrimination policy, which are founded on the provisions mandated by Title VI of the Civil Rights Act, the ADA, the Rehabilitation Act, and Oregon state laws. These are 4 of the more than 10 civil rights legislative acts which provide for protections for certain vulnerable populations. This introductory training briefly reviews the 4 major legislative acts. Title VI of the Civil Rights Act prohibits discrimination in the delivery of services based on race, color, or national origin in programs receiving federal financial assistance. The Americans with Disabilities Act prohibits discrimination in the delivery of services based on disability in state and local government and in places of public accommodation, such as doctors' offices, pharmacies, and hospitals. Section 504 of the Rehabilitation Act prohibits discrimination in the delivery of services based on disability in any program or activity receiving federal financial assistance. And Oregon State Law, ORS Chapter 659A, prohibits discrimination in places of public accommodation based on disability, race, color, religion, sex, sexual orientation, gender identity, national origin, marital status, or age if the individual is 18 years of age or older. OHA is committed to promoting health equity so that everyone can reach their full health potential. By providing for a comprehensive non-discrimination policy and procedure, we are creating a communication mechanism by which the Oregonians we serve can help us better understand the barriers and challenges they may be experiencing when receiving services from our agency or from one of our contractors receiving federal funds. In achieving our goal to protect and promote all Oregonians' health, we must listen to and collaborate with our partners and stakeholders in resolving potential conflict involving vulnerable populations. Innovation may move us to come to the table with an openness and a lens towards resolution not traditionally used for resolving reports of discrimination. As a part of service excellence, it is vital that we respect and quickly respond to the needs of the people, families, and communities we serve, including vulnerable populations, and we must do so with integrity and leadership. As good stewards of the public trust and public dollar, we must continue to help identify potential discrimination and lead by example by reporting any conduct we believe may be discrimination. Discrimination is defined as the denial of services to individuals or groups because the individual or group is a part of a protected class. It includes policy or treatment resulting in unequal access to authority programs and services, or having a disparate impact on a protected class. We will now discuss protected class. Protected class means a trait or characteristic shared among a group which cannot lawfully be targeted for discrimination. This policy protects the following: age, color, disability, marital status, national origin, sex, sexual orientation, race, religion, or any other class protected by law. If the individual is complaining for some other reason, they can still file a complaint. But those complaints that fall outside the scope of this policy should be reported to supervisors and/or brought to the attention of our customer service center. Discrimination based on sexual orientation can include treating someone less favorable because of that person's actual or perceived heterosexuality, homosexuality, bisexuality, or gender identity, regardless of whether the individual's gender identity, appearance, expression, or behavior differs from that traditionally associated with the individual's sex at birth. Although Title VI does not contain a definition of race, it has been commonly described as discrimination on the basis of ancestry or physical or cultural characteristics associated within a certain race, such as skin color, hair texture or styles, or certain facial features. It is important to note that everyone is protected from race and color discrimination, regardless of how they identify or even if they do not identify with any race category. Discrimination based on color can occur when a person is treated differently based on his or her skin pigmentation, complexion, shade, or tone, between persons of different races or ethnicities, or between persons of the same race or ethnicity. National origin discrimination can occur if someone is treated less favorably because he or she comes from a particular place because of his or her ethnicity or accent, or because he or she appears to have a particular ethnic background. Discrimination can also occur based on a person's inability to speak, read, or write, or understand English, and based on marriage or other association with someone of a particular nationality. Title VI protects all aspects of religious observance and practice, as well as belief, and defines religion very broadly for purposes of determining what the law covers. Religion can include not only traditional, organized religions such as Christianity, Judaism, Islam, Hinduism, and Buddhism, but also sincerely held religious beliefs that are new, uncommon, not part of a formal church or sect, only subscribed to by a small number of people, including only one person, or that may seem illogical or unreasonable to others. The absence of religious belief is also protected. Disability discrimination means treating someone less favorable because the person has a disability or has a relationship or association with an individual with a disability. An individual with a disability is defined by the ADA as a person who has a physical or mental impairment that substantially limits one or more major life activities, a person who has a history or record of such an impairment, or a person who is perceived by others as having such an impairment. The ADA does not specifically name all of the impairments that are covered. It is important to note that on September 25, 2008, the President signed the Americans with Disabilities Act Amendments Act, and in that act emphasized that the definition of disability should be construed in favor of broad coverage of individuals to the maximum extent permitted by the terms of the ADA and generally shall not require extensive analysis. Discrimination based on age is treating someone less favorably because of their age. Under Oregon law, this applies to anyone 18 years or older. Under federal law, this applies to anyone 40 years or older. Discrimination based on sex can include treating someone differently because that person identifies as male, female, or transgender. Discrimination based on sex can include sexual harassment, pregnancy-related conditions, or nonconformance with sexual stereotypes. Our last protected class is marital status. Marital status discrimination includes discrimination based on whether a person is single, married, divorced, widowed, engaged, or in a domestic partnership. Now let's check in. Can you remember what the protected classes are in OHA's non-discrimination policy? Review the slide before you and choose between answer A, B, C, D, or E. If you chose A, you chose correctly. Any individual or individual's representative who believes discrimination may have occurred based on protected class can file a report of discrimination. An individual's representative can include an advocate, family member, or friend. Anonymous complaints will be accepted, except it is important to note that the investigation itself will be extremely limited when we do not have a contact person. Confidentiality will be maintained to the extent possible during the investigation. Reports of breach of confidentiality are not investigated under this non-discrimination policy. If someone is reporting a breach of confidentiality, please send those reports to the agency's privacy officer listed in our resource list at the end of this presentation. Complaints of discrimination must be filed within 180 days of the date of the alleged discrimination unless good cause exists for delays in reporting. Anyone at OHA can and should accept a report of discrimination. Reports of discrimination can be taken on OHA's form, verbally, or in any manner that contains enough information to allow the authority to investigate. Reports should be forwarded to OHA's Office of Equity and Inclusion. All OHA staff must assist anyone trying to make a report of discrimination. We are all responsible for informing members of the public of their right to make a report of discrimination. For additional resources, such as the OHA Report of Discrimination form, OEI's contact information, and the toll-free number for reporting discrimination, please see the end of this presentation. Now let's check in again. Who is responsible for taking reports of discrimination? Please read the possible responses on the slide in front of you and choose a letter. If you chose D, everyone at OHA, you chose correctly. A report of discrimination should include the following: the reporter's full name and contact information, the name of all the parties involved, a specific and detailed description of the conduct or action, the name and location of the building or facility where action occurred, date or time period in which the alleged discrimination or harassment occurred, and a description of the remedy or solution desired. OHA staff can just fill out the OHA report of discrimination form, but if that is not immediately available, they should try and get as much of the above information as possible, and then forward that to OEI. Time for another check-in. Is the following statement true or false? The non-discrimination policy applies to anyone seeking services within any of OHA's programs. If your response was true, your answer is correct. The policy applies to anyone who is receiving services, seeking services or information, or who is the intended recipient of OHA services. It can be difficult to know when someone is reporting discrimination. It is important to note that there are no magic words. If the person is expressing dissatisfaction and either states that it is because they are a member of a protected class, or you believe that it may be because they are a member of a protected class, you may want to forward the individual's concern for OHA's Office of Equity and Inclusion to make an assessment. Let's do another check-in. An Oregon Health Plan member calls customer service and says, "I don't think it's fair that I have to wait 6 months to see a provider because I live in a rural area. This is discrimination." Based on this information, would you forward this to the Office of Equity and Inclusion for investigation? If your answer was no, you are correct. Even though the word discrimination is used by the Oregon Health Plan member, there is no indication that the person believes they are being treated differently because of sexual orientation, race, color, national origin, religion, disability, age, sex, or marital status. In fact, they've indicated that it's because they live in a rural area. Unfortunately, living in a rural area is not a protected class. One possible option, if the individual is in a CCO, is for OHA staff to contact the CCO account rep. If they are not in a CCO, then it may be appropriate for the OHA staff member to make a referral to the medical assistant unit to assess for emergent needs, and hopefully they can get help sooner for the individual. Our final check-in question. You work in Public Health's Vital Records Office. A customer requests a Russian language interpreter. You don't know how to access a Russian language interpreter. Based on this information, would you forward this to OHA's Office of Equity and Inclusion for investigation? If your answer was no, you are correct. This is not a report of discrimination based on protected class. The employee simply needs a resource to provide services to the customer. It may be appropriate for that individual to talk to their manager to get direction on how to use language interpretation services. If the interpreter information is not readily available from a coworker or a manager within Vital Records, then it would be appropriate to seek additional assistance from OHA's Language Access Service Coordinator. The contact information for OHA's Language Access Service Coordinator is located at the end of this presentation. Modifications for individuals with disabilities. OHA's non-discrimination policy also requires that the agency provide reasonable modifications for individuals with disabilities. It is important to note that modifications for individuals with people with disabilities will be covered extensively in a subsequent training. However, the most common requests for reasonable modification can include providing materials in alternate format, such as Braille, large print, and audio, physical accessibility, and sign language interpretation. This concludes our presentation. Please see our resource list for any additional information. Thank you for your time.